Using medical marijuana as a remedy for PTSD and other health issues among veterans has gained more acceptance in recent years, but there's been one major roadblock to its use: the federal government. Could 2023 be the year that begins to change? That's the question after a key Senate panel approved new legislation regarding cannabis in veterans' treatments. Under the measure advanced by the Senate Veterans Affairs Committee, federal officials would be required to hold clinical trials on the use of medical marijuana for both chronic pain and post-traumatic stress disorder. It would also call for a study into how the use of the drug can affect veterans' quality of life, for better or for worse. Right now, doctors working at the Department of Veterans Affairs cannot prescribe medical marijuana to patients, even in states where it is legal to use. They can talk broadly about the potential benefits or problems with cannabis use, but they offer no direct practical advice on whether it can provide relief to veterans suffering from issues like long-term depression or poor pain management. Veterans advocates believe the new study could be the first big step in changing that. Already, the National Academy of Sciences has found significant evidence that cannabis is helpful in treating anxiety and post-traumatic stress disorders, but federal research has been limited because marijuana is still classified as a dangerous substance by the Food and Drug Administration. The new study proposal has been floated in Congress before. House lawmakers have passed similar proposals in recent years, but this is the first time a major Senate panel has approved the idea. And passage came with broad support from both Republicans and Democrats. An identical bill is working its way through the House now, also with bipartisan support. Veterans groups say they're optimistic that the measure can make it to a full vote in both chambers soon and potentially become law by the end of the year. That work could still be sidelined by other priorities and controversies, however. One of those potential roadblocks is a developing fight between Hill Republicans and administration officials over the issue of abortion.
Secretary Austin signed a memo directing the Undersecretary of Defense for Personnel and Readiness to oversee implementation of a number of initiatives designed to ensure reproductive health care access for our service members and their family members, and to bring clarity to DoD policies in the wake of the Supreme Court decision in Dobbs v. Jackson Women's Health Organization.
Recently, House Armed Services Chairman Mike Rogers threatened to block some Defense Department authorities in response to new rules from the department allowing service members to be reimbursed for travel across state lines to receive abortion services. Defense officials said the move is needed in response to last summer's decision by the Supreme Court to overturn the long-standing Roe v. Wade decision, which legalized abortion nationwide. Since then, dozens of states have put limits on the procedure or outlawed it entirely. Military advocates have said the ruling hits military members particularly hard because they have limited choices where they are assigned and when they can travel. The new policy is meant to ease some of that difficulty. But Republican lawmakers have said the new policy is a way of getting around those state bans on abortion, using taxpayer money for a procedure that many individuals find morally offensive. Alabama Republican Tommy Tuberville has threatened to block all Defense Department nominees until the policy is reversed. Rogers said he's looking at the upcoming defense authorization bill debate for ways to rescind or limit the new Defense Department policy. Hearings on the issue are expected in coming months. Whether that fight overshadows other priorities for troops and veterans on Capitol Hill remains to be seen. For Military Times, I'm Leo Shane.